Welcome to Ovca Australia's Awareness DVD on ovarian cancer. I'm Raylene Boyle and I'm an interested party because I'm an ovarian cancer consumer now. We're very aware that to save lives from ovarian cancer, early detection is a major key. Women need to follow their instincts about their health, and if you do have any concerns at all, follow them through to a reasonable outcome. We want women to share the information on this DVD, and if you have any worries at all, please be sure to go and see your GP.
My family wasn't really aware of ovarian cancer until my mother's sister, my auntie, was diagnosed. She was about 65 years of age. I guess we didn't realise that mum would eventually be affected by it as well. But 3 years later, mum was suffering from what we now know are symptoms of ovarian cancer and went to see the GP. She was sent off for a series of tests to, I guess, confirm that it could be ovarian cancer. Her ovary, that is normally the size of an almond, was 16 by 8 centimetres, so it had grown considerably and moved out of the ovary. Unfortunately, mum passed away in 2001. She put up a very good fight, but unfortunately she didn't make it. So I guess the reason we're so passionate about it, and the reason I'm so passionate about it, is because we want to make sure that other daughters, other women, don't have to go through what my mum went through and what my family has been through.
I must admit, I probably don't know that much about it.
Not much.
Yeah, not much at all.
Yeah. Not much idea about how it's happening, why, I don't know.
No idea.
I would guess they're like stabbing pains maybe.
I wouldn't know what to look for. Honestly, no.
No.
I was very unwell, but I didn't recognise that I was very unwell.
Very tired, and I put that down to just getting older.
I'd been quite sick, and I guess in hindsight, looking back, I'd probably been sick for about 3 or 4 months, but didn't realise that there was anything wrong.
The symptoms that accompany cancer of the ovary are silent symptoms. They are symptoms that are non-specific. They are symptoms that a woman gets regularly.
Unfortunately, there's symptoms that men have sometimes as well, things like backache, things like gastrointestinal changes, so bowel habit changes, indigestion, those kind of things that we can suffer from at any time in our life.
We rode motorbikes, and riding the bike when we went over a bump, I felt like a bang that hit down here, and I just thought it was the shockers.
I started to get pain in my abdominal region, and we'd just renovated an apartment, so we'd been painting ceilings, and I'd said to some friends, when you pull muscles, what does it feel like? And it was the same sort of feeling as what I had. And probably about 6 weeks later, the pain hadn't gone, and so I was still trying to diagnose myself and asking questions about how long does the pain last when you pull muscles, and it seemed that it had been going on a bit long, so I went to my doctor.
I was totally exhausted all the time. Any effort at all seemed to be too much for me, and I would always think I should work harder to get fitter. I didn't ever think, well, look, I was sick, that could be the cause of it.
The symptoms are so vague that people tend to do, women, do what I did, and you try and diagnose yourself. So there's a reason for being tired. You know, if you're a teacher like I am, looking after teenage kids, you've got a reason for being tired. If you're looking after your own kids, you know, chances are you're going to be tired.
And the symptoms that women will experience with cancer of the ovary are things like abdominal swelling, bloating in particular. Sometimes they press on the bowel, so they can cause an irregular bowel habit, pass urine more frequently, severe pressure in the pelvis. The important thing for women to realise is that if these symptoms are persistent, symptoms continue for 1 or 2 weeks, hopefully a woman will realise that this is not normal, and she will then go to her doctor for advice.
Yeah, I know that pap test can do. But
I believe so, yes. I would say yes.
To a certain degree, I think so.
Many, many women believe that the pap test will pick up all sorts of cancers, including cancer of the ovary. However, I think it's pretty obvious that a pap test which is taken from the outside of the cervix through the vagina will very well detect any abnormalities here, but the ovaries are miles away from the cervix, so it's very unlikely that a test on the cervix will pick up an abnormality of the ovary.
The first thing I'd do is a transvaginal ultrasound, and it's very important that that ultrasound is done by a gynecological ultrasound group, not just at your normal x-ray place, because the quality of the scans is far superior, and they're gynecologists, they know what they're looking for.
So she sent me for an ultrasound, and I went for the ultrasound on the Saturday, and then the person doing the ultrasound sent me straight back to the doctor, and I went into the Mercy Hospital on the Monday morning.
Ovarian cancer will not be detected by pap smears, and women should certainly not rely on a pap smear for anything else but detection of abnormal cells from the cervix.
If I've felt an ovarian cyst, I often do a blood test called CA125. I don't do that as a routine screening because it hasn't been shown to be a great tool for mass screening. But in women who have an ovarian cyst, or they've had a family history, or they've had a past history of ovarian cancer, then it's a good tool.
Cancer of the ovary can affect a woman of any age. We've seen cancer of the ovary affecting 13-year-old girls, and we've seen cancer of the ovary affecting women in their late 80s and 90s. There is some evidence that a high-fat diet will increase a woman's risk of this disease.
Family inherited risk. My mother had it, she's obviously passed it on to me.
And there's also some evidence that talcum powder used at the time when a woman was a little baby may increase her risk also.
I would urge women to be responsible for their own health.
I think women have to be proactive,
Take note of their bodies.
and you know when there's something wrong.
Anything that's different around that area.
I mean, you can be in denial and you can say, I haven't got time, or it'll be okay.
Be a little assertive with their GP.
If you don't get the right advice the first time, if you're not happy with it, seek more.
We've got to get our women to go to the doctors. We've got to empower them, actually get them to go there and say, is it my ovaries?
There's always the anxiety that I'm going to look like a hypochondriac, I'm going back and I've really only got a stomach bug like everybody else. But what does that matter when you're playing with your life?
The good news is that we know if women go to their doctors with the early symptoms of ovarian cancer, that their diagnosis will be made earlier, and as a result of that, their cure rate will be more than 80%. This is good news for women, so let's encourage women to go along to their family doctors if they're worried about their symptoms.
My early diagnosis has been responsible for my having 20 years more of life.
Remember, it's your health. Look after it.